Assalamualaikum and good morning to Madam and everyone. My name is Mohamad Amar Nazreen bin Muhammad Sayuni, and on behalf of my group, I would like to welcome you to our presentation. Today, our group will be presenting our presentation entitled Metabolic Disease and Disorder, a review of 5 common conditions for the subject CEM 6112, Biochemistry for Environmental Health. In this presentation, we will discuss 5 common metabolic disorder, namely type 2 diabetic mellitus, obesity, hypothyroidism, gout, and metabolic syndrome, including their causes, clinical feature, treatments, and presentative measure. Now, let me introduce our group member. Our group consists of Muhammad Daniel Hezaq bin Ruszi, Afiq Shakirin bin Haji Daud, Muhammad Norhafiz bin Muhammad Zain, Muhammad Amar Nazreen bin Muhammad Sayuni, Daryl George, and lastly Izzah Binti Bahari. Now, I would like to invite Daniel to begin our presentation with the introduction.
Thank you, Amar. I'm Daniel. I will be continuing this presentation. So first, let's go for introduction. This is about metabolic diseases. So the metabolic diseases are disorders that interfere with the body normal metabolic processes. This is including energy production, hormone regulation, and nutrient metabolism. There's a few common risk factors that contribute to these diseases, which is including genetic predisposition, hormonal imbalance, unhealthy lifestyle, and aging. This condition can increase the risk of chronic diseases, reduce quality of life, and place a greater burden on healthcare system. So in this presentation, we will discuss 5 common metabolic diseases, which is the first one is type 2 diabetes, the second one is obesity, and then we have hyperthyroidism, gout, and last but not least, metabolic syndrome. So I will begin with type 2 diabetes. So type 2 diabetes is a chronic metabolic disorder caused by insulin resistant or inadequate insulin production, resulting in high blood glucose level. So the main cause include obesity, inactivity, unhealthy diet, and genetic predisposition. The common symptoms are frequent urination, excessive thirst, fatigue, and blurred vision. So when we talk about the treatment will be focusing on maintaining a healthy diet, regular physical activity, medication or insulin therapy when needed, and routine blood glucose monitoring, of course. So next, I will pass this presentation to Daryl, who will explain obesity and hyperthyroidism. Thank you.
Thank you, Daniel. Okay, so obesity is a chronic metabolic disorder characterized by excessive body fat accumulation, which increases the risk of many chronic diseases. The major causes include excessive calorie intake, physical inactivity, genetic factor, and hormonal imbalance. If left untreated, obesity may lead to complications such as type 2 diabetes mellitus, cardiovascular disease, hypertension, and sleep apnea. Management includes a healthy balanced diet, regular exercise, behavioral therapy, and bariatric surgery for severe cases. Hyperthyroidism occurs when the thyroid gland produces excessive thyroid hormone, causing the body metabolism to speed up. Common causes include Graves' disease, thyroid nodules, thyroiditis, and excessive iodine intake. Patients often experience unexplained weight loss, rapid heartbeat, nervousness, anxiety, and heat intolerance. Treatment options include anti-thyroid medication, radioactive iodine therapy, surgery in severe cases, and regular thyroid function tests. Next, I would like to invite Norhafiz to continue.
Thank you. Gout is a metabolic disorder caused by elevated uric acid levels in the blood, leading to crystal formation in the joints and painful inflammation. Major causes include a high purine diet, excessive alcohol intake, kidney disease, and genetic factor. Common symptoms include sudden severe joint pain, swelling, redness, warmth, and recurrent attacks. Treatment includes anti-inflammatory medications, uric acid lowering medication, adequate hydration, and following a low purine diet. Metabolic syndrome refers to a group of metabolic abnormalities that occur together and significantly increase the risk of cardiovascular disease, stroke, and type 2 diabetes mellitus. Its main causes include abdominal obesity, physical inactivity, insulin resistance, and genetic factors. Clinical features include abdominal obesity, high blood pressure, elevated blood glucose, and abnormal cholesterol level. Management focus on weight control, regular exercise, healthy eating, and controlling blood pressure, blood glucose, and cholesterol levels. I will now invite Izzah to continue.
Thank you, Hafiz. This table summarizes the five metabolic diseases discussed in our presentation. Although all of these diseases affect the body's metabolism, each has different causes, clinical features, and treatment. For example, type 2 diabetes is mainly caused by insulin resistance, while hyperthyroidism results from excessive thyroid hormone production. Gout is Gout is associated with high uric acid levels, whereas metabolic syndrome involves several metabolic abnormalities occurring together. Despite these differences, healthy lifestyle modification remains an important strategy for preventing and managing most metabolic diseases. In this slide, I will explain the role of environmental health officers in preventing metabolic diseases. Firstly, we promote healthy eating habits and encourage regular physical activity through health education and awareness programs. Secondly, we encourage routine health screening to help identify individuals who are at higher risk. Additionally, we support healthy public policies and help create healthier environments that encourage healthy lifestyle choice. Finally, through this effort, we help reduce the burden of metabolic diseases and improve the overall health of the community. Thank you. Now, I would like to invite Afiq to conclude our presentation.
Thank you, Puan Izzah. Assalamualaikum warahmatullahi wabarakatuh. My name is Afiq Shakirin. In conclusion, metabolic disease such as type 2 diabetes mellitus, obesity, hyperthyroidism, gout, and metabolic syndrome have become increasingly common worldwide. Understanding their causes, symptoms, and treatment options is essential for early diagnosis and effective disease management. By adapting healthy lifestyle practice, promoting health education, and encouraging early intervention, we can reduce the burden of disease and improve overall public health. For the reference, these are the references used in preparing this presentation. Our information was obtained from reliable sources, including the World
Health Organization (WHO), the American Diabetes Association, the National Health Service, the National Institute of Diabetes and Digestive and Kidney Disease, the International Diabetes Federation, and several standard medical textbooks. These references ensure that the information presented is accurate, current, and evidence-based. Thank you for your kind attention and time. We hope this presentation has provided a better understanding of common metabolic disease and the importance of prevention through lifestyle. Thank you, and we welcome any question.